I want to introduce Josh Barrett first. And Josh is an occupational therapist that works with us here in the clinic. And as I was telling Betty, anybody that doesn't know occupational therapy, the difference between that and physical therapy, occupational therapists truly specialize from the shoulder down. So when you start getting into the intricacies of the hand and all of the different ligaments, muscles, and all the way to the wrist and all that, it can get quite involved. And occupational therapists specialize in those. So they specialize in the hand, they specialize in the wrist, and they specialize in the elbow, all the way up to the shoulder. So I invited Josh to come on today solely so that we can get a deeper understanding of shoulder injuries. So I'm glad that we parsed a schedule and was able to shove him in here. I see you ran downstairs and you got your own room there, so that's good. So Josh, welcome. Can you just briefly kind of introduce yourself, anything that I haven't touched on, and just share a little bit about maybe your background or your development in shoulder injury rehabs?
Absolutely. Welcome, everyone. Like Rob said, my name is Josh. I started off as a rehab aide in Tillamook, Oregon at a hospital down there. And that's where I truly started to become interested in therapy. And this was after my Coast Guard career. And I really enjoyed it. And the shoulder really fascinated me because it's very dynamic. But I worked with some great occupational therapy practitioners down there. They kind of guided me. And then from there, I went to school. And then my wife's from Spokane, so she wanted to be back up here. I got a job at Buena Vista, worked there for a little while, and then came here. And so I've done hospital, skilled nursing, and now at a privately owned outpatient clinic. And I must say, I prefer it here. So far, this has been great, and we have great people, great patients, great clients. I love it.
Yeah, I just wanted to have that on recording, so thank you.
Yeah, we're done.
So we're done now. So really, what inspired you with shoulder injuries particularly? What's an area there that you really wanted to specialize and work with the shoulder? What kind of drove you towards shoulders overall?
I grew up playing sports, playing baseball, soccer, not as much shoulder involved, but played a lot of sports. And then being, like I said, at the hospital there, just the amount of different, it's such a dynamic joint. And I'm a problem solver by nature, and the complexity of the shoulder leads to more problems that I can try and solve. And I just love that aspect of it, trying to figure out what's really behind the pain or the dysfunction. And then if, sometimes you might not be back to 100%, and I get it. And that's where occupational therapy comes in. We're really good at analyzing tasks and finding another way you can do it if we can't get it back to 100%. So it's all really, really interesting to me, and I enjoy it.
Yeah, I mean, for me particularly, I like the shoulder, and the part of it is the shoulder's complex in its anatomy. So what do you really see as within the anatomy that kind of leads to a lot of the injuries that we see for individuals?
So there's a lot of muscles, ligaments, all that in there that work with each other, but on opposite ends. So if you have an injury, let's say to somewhere in your rotator cuff on the front side of your shoulder, it's going to affect the back side of your shoulder. It's going to affect, you could have something in your cervical neck that's affecting, now you got pain in your scapula. Your scapula is not moving correctly and not allowing your shoulder to move the way it is. So I don't know. It's hard to pinpoint it because there's so many different little things that can affect it. But ultimately, I would say I don't know if this answers, or if I'm staying on task with your question. I'm not great at interviews, but a lot of overuse, a lot of falls, postural guarding. These are all things that our lives have come to where we're on our phones a lot, we're on our computers a lot, we're working right in front of ourselves, our head's down, our hands are here. So our shoulders tend to round in, our back, our shoulder blades spread apart, and we lose that strength that holds our shoulder blades together. And it narrows the spacing in your shoulder. So we have a lot of injuries when in the past you would think, all right, especially in this area, farmers throwing hay bales, throwing hay bales, injuries like that were pretty common. But now we're so technical that a lot of our injuries are from our workplace, our home setup, just the nature of the way our lives are now. And so with occupational therapy, we're noticing a lot more of those injuries where it's more postural.
Well, and I want to touch on what you said earlier too, when you're talking about the multiple different functions from the scapula to the cervical spine to the shoulder itself to the ligaments to the muscles. I mean, it sounds like what you're really saying is it's pretty complex, and anywhere in those that part of the system breaks down, it affects it as a whole.
That's where I was starting to get at, and then I went off on another road down another way, but I tend to do that.
Yeah. So yeah, I mean, the shoulder itself, very involved. When you're working with a lot of these common shoulder injuries, I see a lot of individuals that come either in the 4%, the PPT, and they start talking about their shoulder. What are some of those common ones that you typically see that that, man, a certain percentage of people are going to get these? What are those most common shoulder injuries that you really encounter?
Okay, so you got your typical, your rotator cuff tears. And when I say tear, it doesn't have to be a complete tear all the way through. You can have a partial tear, but that's a very common one. You've got bursitis, where the cushioning inside of the shoulder isn't doing what it's supposed to do. You've got arthritis. We can have bone spurs. I mean, there's a lot of different things, but typically, we see a lot of people who have, let's say, a rotator cuff tear or some injury from a fall or overuse or just time. Our shoulders tend to wear down. And so with those injuries, we can definitely treat them. And a lot of people think just because, I got a shoulder problem or I got a shoulder tear, I need to go in for surgery. Mm-hmm. And that's not the case. More times than not, we can fix that through therapy by strengthening the shoulder correctly, giving wherever that pain is, giving the other muscles that are probably weaker, which are causing that pain, a narrowing in the shoulder, or a narrowing in the spacing in the shoulder due to lack of strength on another part of the shoulder. And we can address that. And we have tests that will identify, where the pain is and what's causing it. And then we can treat it from there. And oftentimes people are like, man, I thought I was going to need surgery. I am so glad I came here because I did not want to be in a sling for 6 weeks. And then, months of recovery after that.
Right. Yeah, no, I mean, I think you hit it on the head there when you're talking about rotator cuff, not just, the ones that we see that require surgery and you can't lift the arm, but just those partial tears or even this rotator cuff strains. I know that you see a lot of those in there. The other one that I see quite a bit that I don't think we touched on yet, but you mentioned the narrowing. What about shoulder impingement? Are you still seeing a ton of those in the clinic?
Yes, we do. We do see a fair amount of shoulder impingement, and that's actually quite common, and that's something we've been very successful treating is the shoulder impingement, and it all comes down to a lot of times with that impingement, it's just the positioning in that shoulder, where the head of your humerus is in that socket, and it's hitting or binding, and because we don't have enough space. Or, it's the narrowing and the spacing because let's say oftentimes your pectoral muscles are really strong or shortened, and we need to stretch those out because they're pulling your shoulder in and closing that spacing in there. It's very common, but we've been very successful treating it through, strengthening and stretching.
for an individual that might be watching this on replay and they might have come across this on our YouTube channel or other, the one that I think could really help them here today, the question that you can answer, because I get this a lot out in the public, is how can an individual that is starting to have shoulder pain, how can they differentiate between it being kind of this minor issue that might just resolve itself versus a more serious injury that they really need to have somebody take a look at? Is there a way that kind of the layperson can determine, hey, this is the sign where you need to get intervention, you need to go and talk to somebody, and this is the sign that it might just recover on its own?
Okay, yeah, absolutely. There's obviously, if you have a fall and you hear a pop or something crazy, you know that's a serious injury. But if it's just something that kind of came up and it's just kind of, it's starting to annoy me, and it's not all the time, but if you start to feel it more and it starts to affect what's going on in your day, and then you notice, oh, I'm not reaching up to grab something off a high shelf anymore because it hurts, so I'm going to use my other arm. Now you're compensating. Whenever you find yourself compensating, saying, oh, maybe I won't do it this way, I'll do it that way because it hurts when I do it, that's a pretty sure sign that you're starting to have an injury that will probably, if it goes unchecked or untreated, you're either going to compensate for the rest of your life, or it's going to develop into more and more, because out of habit, if it hurts to reach up high, you're going to do it anyway, just out of a natural tendencies that you develop. What I would suggest, if you start to find yourself compensating or feeling that pain more often, or it's always with this one certain movement, give us a call and just say, hey, I'm not 100% sure what's going on. Talk to you can talk to anybody here, but Rob can set up a discovery visit. He can work you through it. I've got time during the day where I can talk to people as well and just kind of walk them through it, ask those questions that we need to have answered to find out if it may progress into something worse.
So if I'm hearing you right, you're saying that an individual where it starts affecting their life. So when they start noticing it's harder to reach up overhead, they can't do the things that they want to, it's starting to disrupt their normal day. That's one sign that they should at least have it looked at. Is that correct?
Absolutely. Yeah.
And then the other one that I get a lot too that maybe we can define, I have people that are going, well, how long should I wait? So they'll say, hey, it's been hurting this long. Should I go have it looked at or not? Is there kind of a time frame that you say, let's say it's just a mild irritation that just started. Should they immediately run out and have somebody take a look at it? Or is there kind of a window, or if they wait this long and it's still bothering after that, that's more of a sign that you need to have it looked at? Is there a time frame that you see?
What I tend to notice is if you're noticing it, it's been a couple weeks and it's still bothering you, I would start to question, should I go see somebody and maybe make that phone call? If it goes on past a couple weeks, absolutely, I would say let's get it checked out, because we see so many patients here who said, it kind of bothered me and I waited a couple months and now it's even worse. And then now we're trying to go back because you've been compensating for a couple months now. So now the muscles have started to get weak, and it takes that much longer. If you can come in sooner or at least get it checked out sooner, and then we can start making a plan, it won't be as long of a recovery.
Okay.
If that answers the question.
Oh, absolutely. So if somebody is deciding, I'm having shoulder pain, I need to do something to take care of this, what are kind of some of those initial steps that someone should take if they suspect that they've injured their shoulder to a point where they need to have it evaluated or looked at?
Yeah, absolutely. You can call your primary care, of course, and trying to get in. I don't know how everybody's primary care is, but I know sometimes it takes a while to get in to see somebody, and that's unfortunate, but it's the world we live in right now. But we can all, like I said before, we can check you out here too. We've got people who obviously know about shoulders, so give us a call and we'll get you pointed in the right direction. Let's put it that way, because without having the information, it's hard to tell exactly what to do. But we're here for you.
So let's take an individual that, again, is watching this, that's other than Betty and Linda, who have both been in our clinic, and they both already know what we do as far as physical therapy and how that works. What about the individual that's looking to do physical therapy, occupational therapy? What role really will the therapy play in that recovery process for any type of shoulder injury? What can they expect out of it?
Absolutely. So we'll begin with education. We'll sit down, we'll talk, you have an evaluation, and then once we find out what the problem is or what's affecting your shoulder, we'll develop a personalized plan just for that individual, because everybody's lifestyle is a little bit different, and we want to treat you holistically and look at you as a person as a whole, and we'll guide you through that process. So we'll come up with your plan of care. We'll go step by step, and we'll adjust as we need to. It's not a set in stone. I mean, yes, we have our plan, but with the shoulder, things fluctuate. So we'll guide you through it. We'll listen, and we'll work with you. We're a team.
Yeah. You're absolutely right on that, because every time I walk in there, you guys are laughing and having fun together. So if you take the individual that might not have been in our clinic or any physical therapy or occupational therapy clinic before, what are some of the common myths or misconceptions about either occupational therapy or just shoulder rehab in general that they might be thinking about that prevents them from coming in, that you can clear up today?
Okay. Well, for one thing I hear a lot is people say, I have to go to therapy 6 times before I can get an MRI, because the MRI is going to, tell me everything and fix everything and get me set for surgery, which, MRI is a great tool. But a lot of times, like I said previously, therapy can get you where you need to be without needing surgery. Some people think, I'm just going to be on an arm bike and stretching bands for the rest, for the next however long I'm in therapy. But that's not necessarily it. I mean, that is part of it. Don't get me wrong. But there's also some nice stuff like massage and ultrasound. We try to make you happy here. But no, a lot of people think, surgery is the only route, I guess, is what I hear a lot. And I want to kind of squash that and just say, it's not always the case, and it's not always the best option.
And I know on my end, I get a lot of people that say, well, physical therapy, PT just stands for pain and torture. That's all it is. And again, we work with you. Sometimes we have to push you more than you want, but that's not the intent. The point is to give you what you need in a kind and fun way. So it's not always pain and torture.
Very true.
So what about an individual that's having maybe a labral tear, and another individual has shoulder impingement, another individual has a rotator cuff tear? Do we just treat all of those individuals the same, or do we tailor that shoulder rehab to the injury? So how does that play a factor?
Yeah, and I touched on that a little bit. We treat everyone here, and I have everywhere I work. That's just who I am. I try to look at everybody as an individual, tailor everything to them. Listening is the biggest thing, just listening to the person and finding out what motivates them to begin. Like what's motivating you to get your shoulder better? What's important in your life? And then tailoring what we're doing to that. And that's occupational therapy. That's what we live for, is, getting you back to doing what's important to you. And then for our, like I said before too, our plan of care isn't set in stone. We're going to fluctuate. We'll listen to what's going on, and we might, like Rob said, we might push you a little, but we're not going to push you to a point where it's past your comfort zone. We're going to work with you.
So let's take let's take an individual that is wanting to make an impact in preventing shoulder injuries. So they either want to maintain their shoulder health or they want to prevent injuries. What are some of those key effective either shoulder exercises or different techniques that you would recommend that they can start doing to give them the best chance to maintain their shoulder health?
Stretch, and then stretch, and then stretch. That's where I'll start. Stretching. And then from there, posture. Think about how you're driving. All of our recliners are comfortable. Don't get me wrong, I love it. But, that's going to, a lot of them round your shoulders forward. Driving, if you're sitting here, arms up, 10 and 2, sitting at your desk, where your mouse is positioned, where your computer is positioned, the monitor height, a lot of ergonomics. Just be more aware of your daily life and how it's set up, because we get accustomed to just sitting one way, or you just like a pair of shoes. If you wear a pair of shoes for 10 years, they're going to break down and you're probably going to have some foot issues or problems with that. The chair you're sitting in, I'd say stretch, take a look at your life, and then strengthening. Getting those shoulders back, squeezing those shoulder blades together throughout the day, rolling those shoulders, stretching your neck, just making those little subtle changes throughout your daily life. Once they become a habit and you get used to doing it, it'll really help.
So you mentioned the posture though as a factor of the shoulder health. What really does posture play in that? I mean, what are ways that if posture is a factor, what are ways that people can kind of improve their posture to prevent any type of shoulder pain?
Okay. So as our shoulders go forward, those muscles between the shoulder blades that hold them back together elongate and they get weaker. And then as time progresses, your shoulder blades who used to sit back here are like this. And then now your shoulders internally rotated, closing in the gap there, like we said before. Your pectoral muscles are shortening, and now they're pulling the shoulder forward, not allowing it to go back. So with our posture and those shoulders forward, our body adapts to it. And then now when you come into therapy, we're doing a lot of stretching to get those shoulders back, strengthening to keep the shoulder blades back so that your posture is better. And listen, I'm guilty of it. We're all guilty of poor posture at times. And it's something you really got to work at. And that's one nice thing about therapy. We'll remind you quite often about, things that you can do, and give you a call, email you, do all kinds of things to keep you on track.
So let's take an individual that has chronic shoulder pain. They've had it for years. It's been bothering them for a long time. They've just dealt with it. Is there something that we can do to help manage that?
In therapy?
Yes.
Absolutely. And when you look at something this goes back to what we talked about earlier, after a couple of weeks, maybe start looking at something, because when it is chronic, it does take oftentimes quite a bit longer to get it back to where you want it. And we're willing to take that journey with you. Don't get me wrong, but it does take a little bit longer. And I like people to be prepared for that. And we talk about that in the beginning. If it took you 5-10 years to get this injury, then it might take a little while to get it back, but we can do it. And don't give up hope and keep pushing along, and we'll get there. Did I answer it?
Oh yeah.
All right.
What about, for an individual that's been in the therapy space for a long time, is there anything that's coming out, anything new, anything emerging, something maybe that you're doing in the clinic or that you're reading more about that relates to shoulder rehab? Is there anything in particular that you're kind of excited about that's starting to emerge as a new treatment paradigm?
I've looked into a couple interesting surgery stuff, and I'm not going to get into that, but they are making some they're starting some different type of 3D printing things that I think is interesting. I just want with shoulder
Yeah.
parts, which is pretty cool. Um,
Wow.
but as far as in here, what I've noticed that's been really effective with patients recently, speeding up the healing process and shortening the amount of therapy time has been our cold laser.
Mm.
That has knocked down inflammation and created a faster healing time.
Mm-hmm.
It's been pretty great, and I've been happy with the results of that. And I'll be honest, at the beginning, I was a little skeptical. I thought, oh, these little flashing lights, what are they going to do? But man, and we're using it on ourselves. Don't tell Rob, but during our breaks, sunburns, we've used it on all kinds of things, and it is incredible how well it works.
Well,
But
that's
anyway,
what we want. We want you to stay healthy and able so that you can keep making the magic happen for our patients. So yeah, use it up.
yeah.
Um, you touched on laser, you touched on early on, and you mentioned a holistic approach to your shoulder rehabs. What does really a holistic approach look like?
So obviously, we're in the beginning, we're going to look at the injury, the pain generator, but we're asking a lot of questions, and a lot of times patients might not even realize it, but we have what we call the if factor, an internal factor, which what's motivating you, what motivates you in your life, and what is motivating you to get better. So we look at that, and then we start making that a priority, and we go back to that often to make sure we're meeting your needs
Mm-hmm.
through therapy. And then on top of that, there's more. So we look at nutrition. We might start talking just casually about, oh, what do you like to eat? What's this and that? Because a lot of foods create inflammation, and inflammation is our enemy. And especially in therapy, inflammation is something we fight all the time. And we can do it here, but you only see us twice a week for 40 minutes. There's a lot of time out there where you're on your own, and nutrition is a huge part of that.
What about because yes, nutrition, huge, big time. What about like mental mindset? I think that's what I'm trying to get. What about people with either a preconceived notion that they come in with or just their mental mindset when they're there with therapy? How does that play a factor at all?
Oh, huge. Yeah. You got people who, I don't want to be here. I'm just here because the doctors make me come here, to people who go, man, I am so excited to be here. I really want to get better. So there's a wide array. And, we got to meet everybody where they're at that time. So listening and finding out, like I said, the internal factors, but also just meeting them where they're at and trying to help guide them and motivate them in a way that's comfortable for them. And, but also beneficial in getting towards the process. So we have to do, but I'm not 80 yet, but when I am, I'm sure I'm already at 44. I'm already stuck in my ways. So sometimes we got to change some patterns or maybe some things that have been going on for a while that people don't want to change. So I have to first build that rapport with them to build trust, and then start working down that road of, okay, let's look at maybe changing the way we do this.
Got it. Okay. Yeah, no, I can totally see that because you have different mindsets of people that come in. So yeah, I'm on the same page as you. As I'm wrapping this up, and then I'll open it up to Betty and Linda if they have any questions that they want to add in and really tailor to themselves or would add value for anybody that's watching this. So for someone that's currently dealing with a shoulder injury, what advice would you give to that individual truly to stay motivated and positive during the recovery journey? Because you look at a lot of individuals, let's say they have a rotator cuff, they're going to be with us 3 to 4 months. Let's say they have labral tear, 3 to 4 months. For those individuals, what advice would you give them to keep them motivated and positive through that process? Because we know that matters.
Yeah. Basically just staying optimistic with them and trying to keep that optimism, going back to what's important to them, and just saying, hey, we see shoulder after shoulder after shoulder. People get better. Not everybody is on the same road though. You
Yeah.
oftentimes we'll get somebody and they're like, well, my buddy, he was pain free and he was done in 6 weeks. But there's so many different factors in a surgery, that not all of them are created equally, and we're not all the same. So don't compare yourself to someone else. Just compare yourself to where you are. And that's why we'll go back and we'll remeasure and check and say, look, you were here and now you're here. And you don't see it when you're living with that shoulder day to day, but we see it as the progression happens.
Got it. So for the individual that they have at the end of different articles now, or they have a summary at the top that says TLDR. You ever seen that? And that stands for too long, didn't read. So for the individual that looks at this video and says, this is too long, I didn't watch, I'm going to give them the cliff notes right now. So I'm going to summarize this and you tell me or correct any part that's in it. So one, that shoulder injuries are common, and that when they occur, we have to look and say if it lasts about longer than 2 weeks, that's a sign that we need to start getting help, or when it starts significantly decreasing the function in your life. That there are different interventions that can be some quick, some are take longer through therapy that can help. And there are different emerging tools such as lasers or different techniques to help make it happen as far as improvement for them. Not everything is a surgical need, that people improve through therapy and rehab just as much as a surgery does. And then for people that want to prevent shoulder injuries from occurring other than the falls and those type of significant unforeseen injuries, but for that chronic injury to maintain the posture that they have, as well as the range of motion to the shoulders, and to consistently build strength to the shoulders and the muscles behind the shoulders, which are important as well. And through this, we'll give them the best chance to maintain shoulder health and give them the best quality of life long term. And if they do have to do therapy, they have the right positive mindset, we'll give them the best chance for recovery. So that's my too long didn't read summary. Is that close, or is there something else that you need to correct or add on to it?
It's pretty good. Stretch.
How did I forget that? You should have said it 5 times instead of 4.
Yeah. And just because you don't have a shoulder injury doesn't mean don't stretch, don't exercise, don't wait till it hurts. Yeah. Be proactive.
Awesome. I appreciate you coming on. I'm going to open this up to Betty. I'm going to hit your guys' little unmute button if you guys want to hit those. Betty, is there any burning question that you have for Josh related to shoulders, therapy, other that he can answer for you now?
Well, first, I just want to say thank you for sharing this part of your journey with us. It's important to know who our healthcare team is, even if I don't have direct need for you right now. Absolutely concur about the stretching, not just for shoulder. And I know she knows too, every day, every part. But I realize that it's the impingement thing you were talking about. We've addressed it in other Zooms. Even in the morning when you get up and sit out of bed, the first thing I do, everybody, it's like you're like there, and then I hear Rob's voice go off in my head. Sit up from another Zoom, and I'm aware of getting my shoulder blades to pull back, because you're absolutely right. Everything we do, not just the phone, the computer, those of us who sew, sitting over a machine. So stretching, I think, is our first line of defense. I think that's a good thing to point out to people. Always concentrated effort between you and us. Avoid the surgery. Take care of it when it occurs. And also, I just want to say, don't worry about going down a different path talking, because I do it all the time. People adjust. So
thank you.
It's all good.
Hey, we know that about you, Betty, and we love it. Linda, something you want to add, question you have, or comment about today or shoulder injuries?
Oh, yeah. I am super excited, Josh, because I work on a lot of injuries, and I'd say probably 50% are shoulder injuries. Mostly women, it's reaching behind and getting their purse or, something like that. But I want to be able to refer. I didn't know what an occupational therapy was. So that's exciting. My kind of current plan is the first visit, I kind of assess where their range of motion is and everything. The second visit, I'm really getting in there. And the third visit, I'm evaluating, is it doing any good? If it's more pain or it's not helping at all, then I want to be able to refer. So, question, do they need a doctor's script first? Or can they just come for what you call a discovery visit? Because that's a holdup, as you know, with getting into a doctor.
Yeah, and Rob can talk to this too. The discovery visit, you do not need a referral for. You can just come on in, and then Rob, and then from there, we can send the referral to their primary care, and they can just sign it and send it back. That's how we do it, Rob.
Yes.
Okay.
Yeah, we don't want there to be a delay in the care they need. So the discovery visit's usually with me so that we can see, okay, yeah, there's enough here that it sounds like this is the issue you're having, and we're going to create a pathway. So it's either you need to see us, you need to see your primary, you need to get an MRI or whatever. So at least it gives them direction. And then from there, we decide how we're going to do it. Now, any individual can come and see our team without a referral, but sometimes insurances won't pay for it without a physician referral. So that's for the individual to decide at the time. We have a handful of people that go, I don't know when I can get to my doctor. I'm just going to pay directly to you. That's fine. We have other individuals that we can send a referral directly to their doctor through fax, and the doctor we have a relationship with says, hey, that's fine, I'll just sign it for you. So it really depends on the individual, which is why that discovery visit's so important, because we can really solve the problem for them because we work with these issues all the time. So good question.
Great question.
And then one last question. When a person is complaining, and even myself, when I sleep on a shoulder, I'm assuming it's an impingement, but my shoulder aches and it doesn't hurt any other time. So are you thinking that is an impingement when people complain of that?
Yeah, I mean, it definitely can be. And great question, or great point about sleeping. I think we do more damage to ourselves sometimes sleeping than at any other time. And that's when we should be hopefully healing. But yeah, it could be an impingement, it could be just that pressure constantly, throughout the night, just pushing in there and it being pressed up against, and then, getting that spacing, getting that shoulder to relax, getting the cushion back in there and moving it around. That's why it starts feeling better throughout the day. Once you start moving it and getting it going, now it's worked itself out. It's got what it needs for padding and to do its job. But that's something to look at. If you're waking up every morning with pain, that's no way to start your day. And that's something we can definitely address, because I know I don't want to wake up with pain every day.
Right.
Every day.
Yeah.
But it could be something as simple as changing, the way you're sleeping. But that's, like I said, we're creatures of habit, and that's hard to do sometimes.
Yeah, it is. Okay, thank you.
Mm-hmm.
Other questions, you two? All right, guys, if you got further ones moving forward, please put it in the school app. We'll still answer those, as you know. So it's been a good addition for us to extend what we're doing. So I thank you being on today, taking your time up, asking Josh questions, and I'll see you in the clinic.
Thanks.
Thanks, Josh.
Thank you all. Yes, thank you.